Hi, welcome to City Talk and City Walk. Well, up to now, my partner is still busy attending to so many civic concerns. So here I am, City Talk. And we'd like to continue with our focus on our kidneys. And in this segment, we will consider the question, why bother about your kidneys? Last segment, you saw a young man who is now in his CKD stage 5. And we explained what that was. The question is, as you saw in our beginning video clips, there is now a mushrooming of the kidney dialysis centers in our city, almost in every 3 streets or so. This is not an exaggeration. You go to the Robinson Triangle area and the Chinatown there, our Tindalo Nara streets area, and you will find 1 or 2 kidney dialysis centers. You go to Lacson, you'll see one at 14th, 15th Street. It's a common sight now in Bacolod. And that was not so in the 80s when I first moved in to Bacolod. So, why is this phenomenon? What's the reason behind this? And to help us understand why chronic kidney diseases and the consequent need for dialysis have become epidemic-like. This is on top of cancer, which we have been discussing, heart disease, diabetes. And with diabetes goes kidney problems. But there are other probable causes for chronic kidney diseases. So with us is a young doctor, Dr. Cesaro Mesias. Welcome to City Talk, City Walk, Dr. Ces, as our friends would call you. And thank you for giving time for this health empowering program. So let me ask you, how would you explain this phenomenon of chronic kidney diseases becoming almost epidemic-like?
Nowadays, because of the lifestyle of the people now, the rise of incidence of diabetes and hypertension. So these are the 2 common causes of chronic kidney disease. And it all goes back to this disease, like our lifestyle, smoking, alcohol, our eating habits now because of this lack of burgers, oils in our diet, and also the stress in life. It's one also the factors because it also causes like hypertension. Nowadays, disease are more of a lifestyle. So that's why these factors could damage most of their kidneys and cause this symptom of CKD.
Okay, so you are telling me that chronic kidney diseases is really a matter of lifestyle.
Yeah.
Daw mo man na sa cancer?
Yes. Actually, they are all interconnected.
Interconnected.
Yes.
Okay.
So diabetes also have an increased incidence of cancer, smoking,
Okay, so the most basic causes would be, you said drinking, alcohol, smoking. I thought smoking is directly related to cancer of the lungs.
Yes.
So it could also be a probable cause of kidney deterioration.
Yes. Because, kidney is an organ which is highly vascularized. And
What do you mean by that? Anong buot silingon sina?
It means that it made up of a lot of blood vessels.
Okay, blood vessels,
So,
yeah.
anything that damages blood vessels injures the kidney.
Oh,
So,
anything that damages blood vessels.
like
Okay.
hypertension,
Oo.
smoking.
Yeah.
Okay? Amo na mga kita, may mga burgers disease, may mga smoky, kung may mga
Oo.
sa mga kamot nato, may mga
Mga,
na, no?
oo, nag-itom-itom na.
Yes. Ako na siya.
Oh, I
So,
see.
that's why it attribute.
Okay. Pero if you have uncontrolled or yun bang unattended hypertension, pero may nga taas ang
Yes.
blood pressure mo, that could most likely result to chronic kidney disease.
Yes.
Okay.
Because, kidney is supplied by only one single artery,
Which is what?
renal artery.
Okay.
Okay?
Explain
Yeah.
renal artery in layman's term.
So,
Sa Ilonggo, ano ang renal artery?
ang renal artery, amo na sa sang mayor na ugat na nagahatag sa dugo sa kidney.
Okay.
Tapos, ang kidney, ginalimpyuhan niya na ang aton dugo. Tapos, ibalik niya sa lawas ang limpyo na dugo.
Nga limpyo.
So, kung may taas ang hypertension mo, ka-damage man ang imo kidney. Hindi lang to ni kidney, pati ang imo
Heart mo.
pati
Yes.
imo brain, kiti
Yes.
stroke,
Yes.
mga ischemic heart disease,
Yeah,
sila.
your answer is actually significant because it is pointing to the fact that we are a whole. Holistic idya. Hindi kita pwede magtanaw lang abi nga I say this because in this age of specialization, if you have heart trouble, you go to a cardiologist. If you have kidney problem, you go to a nephrologist. And the tendency for this specialist approach is that the doctor, the specialist tends to look at you mainly in terms of your kidney lang. Di ba lang? Gone are the days when you have general practitioners and less of this highly specialized medicine, di ba?
As a roles, amon na urologist,
Oo.
we tend to be more of the preventing side.
Preventive side ka mo. Okay.
Like, example, may kidney stone ka.
Oo.
One of the common cause ng kidney damage is obstruction sa kidneys mo.
Okay.
Like BPH, like kidney stones. So,
Okay, explain to us. Lain naman ang chronic kidney disease, CKD, sa problema sa kidney stones, which is more common, isn't it?
yes, very common.
Nga by the age of 30, mga mid-30s,
Yes.
many people now have problems with kidney stones. Why is that so?
Because one is related sa aton
Lifestyle.
man, no? We drink less water.
Aha.
Tapos more sa mga chichirya
Kag mga soft drinks.
mga soft drinks, soda. Tapos, ang aton diri climate is more of a dual malamu, wet and hot season.
Hot
So, more related man sa aton environment pagid na ang mainit. So, we need more water
Aha.
as prescribed by kung sa iba na't country tultugnaw.
Oo.
So, that's why common cause pagid sa stone is ang diet naton.
Mga fats.
Fats. Tapos mahilig ta sa mga
Alat.
no? Mga uga,
parat.
mga mais,
Uga.
mga mani pagid niyo, no?
Mani
Oo,
nga deep fried with
Yeah.
salt and betsin.
Mahilig ta na. So, that's why may isa pagid na cause na hereditary na may tao gid dyan na may mga ginabato because may lahi sila na
Predisposed.
Oo, predisposed.
But you don't inherit kidney stones.
Yeah.
Predisposition.
Predisposition. Okay.
Kaya sa DNA nila.
Yeah, so may araw tao na kulang sila sa citrate sa ila dugo na natamo na nagapa-eliminate sang
Citric.
citrate. Nagapa stone inhibitors na siya.
Okay.
Okay. So nagabulig na siya eliminate sang stones.
What about weight? Kung tambo ka, are you predisposed to kidney stones?
Yes, because also the diet.
Oh,
Ganito related
gihapon.
sila.
Oo.
So,
By the
diet-
way, Dr. Ses is really a urologist, but he is a trained surgeon.
Yeah.
Lain naman ang imo branch, you are into kidney transplant.
Yeah.
We'll talk about that later.
Okay.
But, okay, I've been talking about the interrelation between the long lineup in this fast food joint kung tanawa mo da sa Lacson, padaso na da, sunod-sunod yan ang mga, fast food.
Yes.
Mga namit ng mga fast food. And then, did you observe how there's also a long line-up in our pharmacies?
Yeah.
Pero may nga puno ang mga popular drugstore diri. And then, ang naman mga doktor, pero may man nga gutok, mahulat kagid 1 or 2 hours sa mga clinics ng doktor. Kapin pa ang mga popular doctors.
Oh.
How would you explain that, Dr. Sis?
Actually, what is happening now is what I said before, na more of lifestyle. Ako, on my own opinion, no, because of this Western influence sa aton, like this mga food chains, fast face ang pangabuhi. So, we tend to be more, padasigay na lang pala, more, so, we do not want to prepare our foods longer. Wala talaga, kung ano lang na available, prituhon, mahilig paginta sa what we call that, processed foods.
Highly processed foods.
So,
Instant noodles,
yeah,
ramen.
Instant noodles, like mga, ang ato nagid pagkaon na karne mo, patusino, imon pa tapat. So, may kadamo na sa mga...
Vienna sausage, hot dogs.
Yeah. So, this increase the incidence now of diabetes pagid. Diabetes, hypertension, especially the lifestyle na do sedentary, mas more ang mga tao sa computer na lang, less na sang exercise, kag more lang yan sa pagkahapos, kag actually may mga salakyan na tati, masakay na ta, kalapit sila, sakyan pa nato, hindi pa paglakton.
Tapos ma-elevator pa ta, second floor lang.
So, ang mga ako na what I is more of the lifestyle karon. And these diseases also nag-arise as this food change also arises. So, actually makita mo, there are more dialysis centers now because more pabata yung problem sa kidney.
Yeah. How young have you observed in your clinical practice?
As young as 20s.
20s?
I have observed mga 15, may bata na.
Hindi ba lang damo man subong mga 10, mga pre-teens nga may cancer.
Yes.
Di ba? May leukemia.
Leukemia, bladder cancer.
May mga kidney problems, ha?
Yes.
Oo, inang kwan gidya, fatal.
So, fatal. Like, for me, on my practice, the youngest to have bladder cancer is 22 years old. Call center agent, single female. I have that before. But, it's, according to the book, it's mga 60s na dapat.
Oo, dapat.
Subong, it's getting younger.
So, there is really the truth that one can be 10 but have a heart of a 30-year-old.
Yeah.
Because of the diet.
Diet,
Pati
lifestyle.
kabala, nag-observe lang ko to sa mga nag-eco-tour sa Amon Shalom. Ang isa ka bata, 10 years old, overweight na bata. Gid sang doktor, psychiatrist, ang balo niya, lunch niya, 8 long hot dogs. For lunch, 8 long hot dogs. Kaya ang kabataan subong, everyday hot dog.
Yes.
May isa, ang akon gani, assistant sila niya, gareklamo ang parents ang iya ginatuturan, sinututuran, kay nga ang grades niya, nubo manggihapon, why kung may mahimo, kay mala ang brains ng mga bata nyo, kay nga aman, tusino in the morning, hot dog at noon, and longganisa at night. Ang ano bala, ang diet nga ginasiling mo. Well, this problem with kidney stone, how can we be proactive? The growing phenomenon of high incidence of kidney diseases, what can we do to prevent, to forestall it? Nga hindi kita madagdag sina.
Actually, on my let's go basic.
Okay.
Sa ating pangabuhi, no? We have only 24 hours in a day and 7 days a week. So in these 24 hours, usually we allotted at least 8 hours of sleep.
Okay.
Then you have remaining 16 hours. That 16 hours, we have that exercise, work, tapos tanan-tanan na, no? So, actually, in my ano, is balance lang.
Balance.
Okay. Proper diet, enough sleep.
So you're saying that if we break the circadian rhythm,
Yeah.
which is the need to be in deep sleep,
Yeah, deep sleep.
from 11 to 2 a.m., at which time the body is most active in repairing damaged cells and producing new cells. If we turn night to day
Yeah.
and day to night, like the call center agents,
Stress.
stress.
Oh. It adds to hypertension.
Damo may damo
I
sa
have one patient before. He's 28 years old, female, single, who is a supervisor in a certain company. He has a BP of 200 over 120.
which happens only to mga middle age, no?
Middle
Mga
age.
40.
After that, he was because it's always night shift. He was shifted to a regular morning shift. The hypertension was gone. No medication was given again.
So it's basically the lack of
Yeah,
sleep
lack of
or not
sleep,
sleeping at the right
stress,
time.
yeah.
Stress.
So it's really a factor now.
Okay, so you're saying that we must really minimize stress, if not avoid stress.
Yeah,
But,
minimize.
in life, you cannot really eliminate stress.
Yes. But we should. It depends on us. It's a matter of priority actually.
Okay. So you're saying basic, let's go back to the basic one, is having enough sleep. What is enough sleep?
Actually, we are down at 6 to 8 hours a day.
6 to 8 hours.
At night.
There are people who get stressed by not being able to sleep.
Yeah.
They are in bed at 9, pero hindi sila katulog.
So, because of
So they get stressed out.
Because of also of the problems they
Okay.
have. That's why paano ka makatulog kung may utang ka to ginabayaran nasunod daw may nasunod may problema ka to sa farm mo or sa mga laborer mo or may kaaway ka to na may nag-aano sa imo. So I think it's a matter of sa psychological side.
But you know what? I met somebody and said, hindi gid ko katulog. Yeah, okay. Let me ask you, do you have a big TV screen in your bedroom? Yes. What time do you eat? 9 o'clock in the evening. Hindi ka din matulugan sina I mean, many people now have TV sets in their bedroom and they use the TV to put them to sleep. But that doesn't really give you good sleep.
Yeah.
Because you'll be alpha level lang. You'll be sleeping but not really sleeping deep enough for your body to rest.
Yes.
Yeah. So, yung sabi mo, go back to the basic. And I told him, move your TV set away from your bedroom, eat at 6 instead of 9.
Yeah.
So, and then I gave him kefir. And then when I met him again, he said, for the first time in my life, after so many years sitting, I had very good sleep.
Tapos a little lot of water.
Drink a lot.
Water.
Yes.
And
Drinking a lot of water, that's true. We take that for granted, especially those who work in call centers. Coffee lang, coffee, to keep them awake.
Yeah.
But coffee is not good beyond 1 cup a day. Please comment on that.
Actually, coffee is somewhat a stimulant mo. So it will always wake us up. So sometimes patient have ang mga tao nag-insomnia because of that also. Sometimes the stimulant na siya
Yes, and it stays there, no? I mean, you don't secrete it immediately.
On our part as a urologist, sometimes I try to discourage patients to drink coffee, especially if they have prostate problem.
Okay.
Because sometimes it's bladder irritant.
Okay.
So they try to ihi. So
say something more kasi I know you've had many cases of prostate cancer,
Yeah.
no? So can coffee cause prostate cancer?
No. Not really direct.
Not directly.
Actually, more of ng prostate cancer, more of sa mga fatty food. Yeah.
Yes. Okay, so not drinking enough water. You know, one 18-year-old, the son of Ermi, the organic man here, They thought that the kid was going to school, high school. At age 16, nagsugod siya. Gali kay diretsyon niya sa computeran. So, he would be so engrossed in computer games, nalipatan na mag-inom, nalipitan na magkaon, kung ano, mga instant lang, kag pulaw-pulaw da.
Actually, kung lang taon mo gani, if you try to observe sa mga opisina,
Oo.
after we wake up in the morning, how many
Glasses.
glass of water do you drink?
Nalipat na.
Usually one.
Oo.
After that,
Lunch na.
Lunch na. When the next time you drink water? Sometimes
Magpulit.
evening na.
Yes. So, 3 lang, ano, or 4.
Evening.
Yes.
Kaya usually ba, soft drinks na sila.
In between, coffee break. Yeah.
Tapos some of them, pag puli sa balay, they will try to make up. So, mag-drink sila a lot of water sa gabi na. And it tends na sa gabi, pukahon na sila sa pag-ihit naman.
Yes.
So,
That's very true.
Doctoria.
That's
so,
very true.
Sometimes, a sleep was a 6 hours na straight sleep is different from kung cut mo to 2 hours ka bugtaw ka every 2 hours.
Yeah, every 3 hours para
mangihi.
mangihi.
Para mangihi.
That's true. That's
So
true.
sometimes irritable ka na.
Oo.
You're very irritable and sometimes you tend to be, sleepy in the morning and your work will be less productive na.
Yeah.
So amo na
Yeah.
siya usually good.
What about this power drinks, mga Gatorade, mga power drinks bala?
Oo. Actually,
Does that affect your kidney?
Actually, it does not actually. Actually, ang power drinks, damo man sugar mo.
Precisely.
Actually, gaano man ta sa electrolytes.
85% sugar.
Yes. That's why, ako manggapon related, pares na sa mga gina-advertise na nila para pagpaniwang na ng mga drinks na actually more of sugar na. So, it tends to increase blood sugar kag diabetes manggapon.
Diabetes. Now, what's the link between diabetes and kidney damage?
Okay. So, diabetes, increased sugar in your body could destroy the kidney by destroying the nephrons.
Okay.
Which is the basics ang
Mga blood vessels sa kidney mo.
blood vessels.
Okay. So, drinking lots of water, which means 8 to 10 glasses a day. Sleeping, which means 6 to 8 hours. Stress, which means you should not, on a scale of 1 to 10, mga 2 or 3, okay lang na because you need stress to get things going, but not
too much.
Daw parang rubber band nga perbi na stretch out.
Stretch. At tapos eating vegetables and fruits.
Eating vegetables and fruits. Okay.
So, that's actually sometimes I encourage my patient to have a orchard na their own na sila mag-grow sa ilang mga sa ilang ginakaon like mga vegetables na mas better. Kasi sa panahon subong na sa kuay do ka buglay no. Panahon ng tao na may mga time na retired na. So, why not go
Mapuksi ka lang sang ugbos sang kamote, ugbos sang amargoso. Alugbati.
Kamatis sa inyong balay.
Oo. Bisan gani wala duta, Doc. Ano lang, mga paso-paso.
Mga gina-advise ko man. Actually, holistic mangyapon ang approach. It is, ano mangyapon, lifestyle mangyapon.
Balik sa lifestyle gidya.
Lifestyle gidya. Kakaon tagid.
Kaysa ang tion sang aton mga ginikanan.
Actually, ang mga bulong na ini, maibanan ni siya kung sa imo lifestyle maano man.
Oo. Now, I think one problem also why a person suddenly is jolted by the news that he has chronic kidney disease stage 5 na dayon is that they don't know how to tell from the signs that their body is giving them. So how can we tell if we have a kidney problem?
Okay. So kung may kidney problem ka, may mga signs and symptoms na siya. Like, number 1 is anemia ka na. Okay.
So ang anemia is not because napulaw ka, dason. Yeah.
Because there are many causes of anemia, like may mga ulcer ka na bleeding ulcer, may mga ibang amo na kulang sa vitamins, mga iron. So may iba naman yan na dunami man kaon lang dun sakto ba ng ila no nga anemia sila. Okay? So
Kada ang signs ng anemia nang imo kuko,
yes, nagalapsi
lapsi, pati tsura daw yellowish ka na.
Because let's go back sa anong functions ng kidney. So ang functions ng kidney help na sa produce ng erythropoietin.
What is that?
It is an hormone na produce ang kidney na gina-signal yung aton bones na mag-ubra sa red blood cells. That's why, kung ang imo kidney na damage na, hindi na siya mag-produce hormones. That's why sa mga gina-dialysis, gina-injecta na sila sa erythropoietin para may signal na mag-produce ang hormones, mag-trigger sa bone na mag-produce ang red blood cells.
I see.
Kaya wala na siya produce hormones.
So let's say a call center agent, and if only I have a research grant, I'll do a correlation study between the incidence of chronic kidney diseases, diabetes, heart disease, and working in call centers. Is there I presume, I guess there would be a positive correlation.
Oh, actually, because of the lifestyle sa call center agent na panggabi, tapos ang ilang diet na bala.
Ang diet. Good.
Tapos,
Kaya pahapos na lang, instant noodles, 3-in-1, cafe. Kag ano gidya ang coffee da, hindi brewed mo, 3-in-1.
Ang stress pa gina nila.
Ang stress. Ay, okay, they absorb all the pangakig sa mga...
Gabi pa sila.
Gabi. No, they turn night to day.
Yeah.
Kaya tell me, even if you sleep 6 hours during the day, it cannot compensate for actually sleeping in the evening, di ba?
Ang time clock sa ila, sleeping habit.
Ang biorhythm really matters.
Yeah.
Our biorhythm. And some people mistakenly think that if they made pulao, they can bawi the following day. But it actually damages the liver, isn't it?
Damage liver and then talan-talan na in the whole thing eh. Wala ka na sleep, kulang ka sleep. Ang the whole physical being mo do apektado. Emotional aspect pa gid.
That's why siguro there are also a lot of doctors, di ba? Who have these problems. Recently, aton fellow ictus, at age 51, nag-heart attack, napatay dayon. He had the attack right in his clinic.
Yes.
Because doctors also turn night to day, especially if you're intern, no?
Ang isa pa gid smoking, ano pa gid eh. Kung magyapon na lifestyle gyapon smoking.
Lifestyle gihapon.
Sa ginakaon tao gyapon.
Okay. So, what are the telltale signs when you get to be concerned enough to go for blood test or lab test?
Yes, amo na siya, no? May history ka na duga pa.
Anemia,
no? So, kung anemia ka, so hindi ka tulog.
So insomnia.
Insomnia ka man. Tapos, easy fatigability, dali ka kapuyon. Oo. Ang iban sina, no? Nagaplang hubaw-hubaw man.
Ano yung hubaw-hubaw?
Nagaplang periorbital edema, nagaplang...
body retention, and na magamaga.
Fluid retention.
Yung water retention. So, abi mo nagtambok, pero tabang lamig.
Yes. Nagaplamaga ang tiil.
Okay.
So, water retention.
Itanawon mo ang iyakwan din nga maga. Okay.
That's like, kami na, gina-prepare na namon kasi may kidney problem na ni pasyente. Because going back sa function sa kidney, no, they provide hemostasis sa aton body regarding sa aton electrolytes kag mga minerals like calcium, sodium, potassium, no? Tamo na sila. Tapos naga-hormones itong erythropoietin, naga-produce sila erythropoietin sa amo na siya ga-trigger sang blood production, no? Acid-base balance sa aton lawas. pH. Amo na
alkaline, dapat alkaline.
Hindi, balance kita ang pH na dapat for alkaline sites. Tapos, ang ano pagid na is ang fluid.
Okay.
So, amo na siya kung kidney mo,
kung hindi ka na malahas, some people, they complain that they don't sweat at all. Is that an indication?
Actually, it's not all of sweating. It's more of agaplang habok agad because the kidney could not eliminate water. Supposed to be siya na mabalance. So,
what about the urine?
Okay, the urine.
how can you use your urination, your urine, as an indicator that you have to be worried na about your kidney?
Usually, sa urine naman, makita na mo sa amon urinalysis. After sa urine sa production sa urine, kung nag-dutay ng imo ihi,
Hindi ka makaihi.
hindi ka makahi. Less ang ihi nimo.
Kag nabudlayan ka, ang sa Tagalog ang balisawsaw.
Lain pa ginisay balisaw.
Lain pa.
ang ibod sa lihi na supposed to be ang normal urine output naton at least 2 liters a day mo sa well-hydrated patient.
Okay, from day till what? From
24 hours a day.
24 hours, okay.
So at least mga 2 liters. Ang imo ya mga sa isa kadlaw ya produce ka na lang 1 liter, mga 800 cc mga mo na lang na.
Which is about 8 glasses na lang.
Yeah, mga pila na lang mga butang ta mga 4 glasses.
4 glasses na lang.
Oo, daw 250 isa ka glass mo. So mga 1 liter na lang.
Babalaan mo gid na kung hindi ka pala ihi, ano?
Mambatyagan mo gid na.
Okay.
Kamo na sa indikasyon naman kung duta ihi mo. Kay balaan mo, to have a ang isa sa cause man sa kidney disease kung hindi ka dehydrated ka mo. Dapat ang imo kidney well supplied man sa blood.
What about the skin? Your skin becomes like mga
like dry na
very
siya.
dry gid.
Dry gid na siya.
Daw,
Oh,
let's say young ka man pero daw kuritot na imo.
Daw di observe na makita mo sa tsura sa mga patient na kinodialysis ka mga itom, ka mga dry.
Daw ka-pallor, no? Daw
yes,
black na hindi maintindihan nga pagka-black.
Tapos doga plang habok-habok kapag baw-baw. Na mo gina mga itsura sa mga ginodialysis kami.
May mga niwang man.
Yes, because of wala na sila masyado kaya hindi na sila allowed magkaon high protein diet because mamugat sa kidney protein. So amo pag ginagaano.
What about bubbles in your urine?
Actually, ang bubbles na is more of sa amon sinama sa actually it's more of anong bubbles man. Do more of hindi ko na ba sa associated sa kidney disease ng bubbles.
Di ba proteinuria? Di ba ang bubbles in your urine is an indication of proteinuria?
Not really.
Not really?
Ang proteinuria is makita sa microscopic na siya.
Oo.
Na may maputid sila makita. Remember na ang kidney tado sa laan mo?
Daw sa laan siya?
Oh, sa laan. Kung magtimpla ka sa kalamansi, ang liso na siya mo ng kalamansi. So kung maglusot na siya, but silingon, paano naglusot? May bustot ang imo salaan. So ang akong punto.
So Doc says, how can then we be more protective of our kidneys? What can you advise our televiewers?
So ang sa ako lang I advise patient to drink a lot of water, gid. Number 1. Tapos, may mga arthritis pag ito, avoid too much sa mga medications as mga paracetamol, tapos NSAIDs, non-steroidal anti-inflammatory drugs, no?
Di kaya mga doktor man nga, makadto ka gani sa mga specialists sa arthritis, ma-recommend sila mga painkillers, damo-damo, kung ano ba, allopurin.
Actually, they will select drugs which is not really on cause adverse reaction.
Inang may mga gout, amo na, no?
Kaya may mga pain reliever na hindi man siya toxic sa kidney.
Okay.
So like mga tramadol na hindi siya masyado toxic sa kidney.
Oxycodone.
Pero mga ibuprofen, kaya may mga kadamo sa mga over-the-counter medications na
Dolphinal, mga mo na.
Pag may arthritis, inom dayon.
So self-medication.
So, inom lang. Pero they are not treating the cause. Like uric acid build up. So, wala sila inom niya para sa uric acid. Just for
Kung
pain.
Kung taas gid ang uric acid mo, is that an indication nga may kidney problem ka na?
Not really.
Not really.
Pero most patient, one of the common cause ng mga ESRD, end-stage renal disease, number 1 is diabetes, number 2, hypertension. Ang isa na NSAIDs nephropathy, acetaminophen nephropathy, na mga arthritis, na amo man sa cause.
Ang overuse of mga mga
yes.
Ang
so chronic
chronic taking
ng medications.
Kamo nga may mga gout, mga arthritis, you better check the painkillers that you're taking because if it is yung mga mga aspirin-based.
Yeah.
No?
Na, sila na.
Damaging na sa kidney.
Damaging. Kaya haraman niya bulong na low dose na hindi siya makadamage kid. That's why gina-compute na sang doktor. Kaya kami, we are afraid of giving too much medication. Kaya kabalo kami na makadamage sa pasyente. Tapos i-excrete daan sa kidney.
What about baking soda?
Actually, I have good sa baking soda. No? Kaya kadamo ko sa mga pasyente na anecdotal, take sila kaya naga-improve ang ila
sa
cancer
kidney.
sa kidney pagid. Pero
More on the kidney, they're saying baking soda, you put it sublingual, and then you mix baking soda with this apple cider vinegar, that it helps. It is like dialysis like.
Actually, I have not come up with a reading pa sa baking soda, pero may mga anecdotal reports na sila pa-improve sila sa pasyente.
So finally, Doc, because our friendly technicians giving me signal, what is other than drinking more water, avoiding stress, sleeping at least 6 to 8 hours?
So your diet. So you're more of eating vegetables and fruits, fresh
more
fruits.
Of vegetables, less meat.
Yeah, less
Kaya
meat.
mga negrense, palakaon karne, lechon,
Amogin natin.
inasal.
Kung bata-bata, patado amogin na nga ito. Gusto kisa. So, amo nang advice ko. So, lifestyle gyapon na.
Lifestyle.
Sometimes we neglect. Kung may mga problem like may mga stones, so you should seek the help of the professional so that you will be managed to ma-eliminate ng stones.
Paano ba kabalo nga may stone ka?
Usually, most of the patients could complain na may mga flank pains, na may back pain, tapos may mga chronic UTI.
So chronic UTI,
Yes,
okay.
Muna,
pabalik-balik kay UTI. Hindi lang sang babae, kundi lalaki.
Yes. So
okay.
that is one also the common you should see sa pasyente.
Okay.
So i-treat mo gid na, tapos avoid ang lupot blakis na ma-dehydrate. You should be wary about that because may mga pasyente na sobra kalupot, kinapabayaan nila, wala na tubig ang lawas, wala na supply.
Dehydration.
Yes. Damage man ang kidney.
Kay abisang iban, lupot man lang ni.
Yes.
Kapit pa kung sa kuay sa ubra.
Yes. Ibnan ng bulong, tapos ma-dehydrate. So, dehydration also cause kidney damage man.
And also, tooth infection, di ba? Napabayaan nga.
Actually, mga infection na siya systemic na siya
systemic.
Anything na may infection, makadamage.
Pwede na magpanaog and damage your kidney.
Yes.
But remember, at age 40 and above, you're predisposed to hypertension and untreated, unattended hypertension has direct connection to kidney damages, no?
Hypertension, diabetes.
Well, thank you so much, Doc Says. I know you're a very busy man, but you rearrange your schedule so you can be with us and have this studio recording. And friends, if you have questions or comments, contact us at SEACREST Foundation for 336653 or visit us at our SEACREST Foundation office at 4213th Street. Thank you, Dr. Says, and final message.
Okay. May advice to those patients na may mga kidney problem, na may mga symptoms na easy fatigability, like symptoms of urinary changes, like mga So you seek the help of the professionals so that kidney problems could be prevented.
Okay.
Early treatment, prevention is better than cure actually. No?
Oh, yes. Yeah. Wala pa tagani nakatouch, wala na time ng kidney transplant versus dialysis. That's another topic. Okay, thank you. God bless you. I'll see you again next week here in City Talk, City Walk, with our very friendly host, Sky Cable. God bless you.